Hi, welcome back to another drug autobiography. Today, I am human albumin. My drug name? For generic name, I'm human albumin. For brand names, I'm Albuc 25, Albuc 5, Albumark, Albuminar, Alburix, Albutin, Buminate, Flexbumin, Kedbumin, Plusbumin. This is for my chemical name. For drug classification, in therapeutic, I am plasma protein. For pharmacologic, I am a blood derivative. For pregnancy category, it's category C. Animal reproduction studies have shown an adverse effect on fetus, and there are no adequate and well-controlled studies in humans. But potential benefits may warrant use of the drug in pregnant women despite of potential risk. The mechanism of action. Albumin is normally present in the blood and constitutes 50% to 60% of the plasma proteins and 80% to 85% of the oncotic pressure. Exogenously administered albumin increases the oncotic pressure of the intravascular system, pulling fluids from the interstitial space, thereby decreasing edema and increasing the circulation blood volume. This increase in volume reduces the concentration and viscosity of the blood in patients with decreased circulating blood volume and also maintains a cardiac output in shock. In dehydrated patients, albumin has little or no clinical effect on circulating blood volume. Albumin is also used to replace protein in patients with hypoproteinemia until the cause of the deficiency can be determined. In pharmacokinetics, for absorption, albumin is administered intravenously as either 5%, 20%, or 25% solution. For distribution, it is distributed in intravascular space and extravascular sites including skin, muscles, and lungs. In patients with reduced circulating blood volume, hemodilation secondary to albumin administration persists for many hours. In patients with normal blood volume, excess fluid and protein are lost. For metabolism, although synthesized in the liver isn't involved in clearance of the albumin from plasma in healthy individuals. Albumin solutions have plasma half-life of 16 to 24 hours and a duration of volume expansion of 12 to 24 hours. Albumin is 5% is osmotically equivalent to an equal volume of normal human plasma and will increase the circulating plasma volume by the amount of the equal to the volume infused. Albumin 25% solution will draw approximately 3.5 times the administered volume into the circulation within 15 minutes in adequately hydrated patients. The degree and durations of the volume expansion depend on initial blood volume. When administered to patients with diminished blood volume, the effects of the infused albumin may last for many hours. However, the duration is much shorter in patients with normal blood volume. In a 70 kg patient, total blood albumin is approximately 350 grams. Albumin has circulating lifespan 15 to 20 days with turnover of approximately 15 grams per day. For excretion, little is known about excretion in healthy people. Administration of albumin decreases hepatic albumin synthesis and increases albumin clearance if plasma oncotic pressure is high. In certain pathologic states, the liver, kidneys, and intestines may provide elimination mechanisms for albumin. Indication: shock. Albumin is indicated in the emergency treatment of shock and in other similar conditions where the restoration of blood volume is urgent. If there has been considerable loss of red blood cells, transfusion with packed red blood cells is indicated. Shock due to hypovolemia. Adults initially rapidly administer 5% solution IV as the plasma volume approaches normal infused IV at the rate of 2 to 4 ml per minute. May repeat initial dose in 15 to 30 minutes. Continued protein loss may require administration of whole blood and/or other blood factors. Children with shock due to hypovolemia may be administered with 0.5 to 1 gram per kilogram per dose of IV, may repeat as needed. Maximum dosage is 6 grams per kilogram per day. Neonates. The usual dose is 0.5 kilograms IV as 5% solution. However, dosage may range from 0.25 to 0.5 grams per kilogram IV. The 25 solution should be avoided in preterm neonates due to the risk of intraventricular hemorrhage. Burns. Albumin or albumin in any either normal saline or dextrose is indicated to prevent marked hemoconcentration and to maintain appropriate electrolyte balance. Hypoproteinemia with or without edema. Albumin is indicated in those clinical situations usually associated with a low concentration of plasma protein and resulting decreased circulating blood volume. Although diuresis may occur soon after albumin administered has been instituted, best results are obtained if albumin is continued until the normal serum protein is regained. Contraindication. Albumin hypersensitivity. Use of albumin is contraindicated in patients with a history of albumin hypersensitivity or hypersensitivity to any of the excipients. Discontinue administration immediately and institute appropriate medical treatment if a hypersensitivity reaction is suspected. Another is anemia, coagulopathy, electrolyte imbalance, esophageal varices, heart failure, hypertension, pulmonary edema, renal failure, surgery, trauma. Albumin is contraindicated in patients with severe anemia or heart failure with normal or increased intravascular volume under the conditions where hypovolemia and hemodilation may occur. Adjust the albumin dose and rate of infusion to the patient's volume status. Contraindication is for viral infection. Albumin is derivative of human blood. As with other products derived from purified with human blood components, the remote responsibility of contamination with CGD or other viral infection exists in patients receiving albumin. The manufacturing process are designed to reduce the risk of transmitting viral infection. No cases of transmission of viral illness or CGD have ever been identified for albumin. Report on infections thought to have been transmitted by albumin to the manufacturer. Dehydration. Patients with marked dehydrations require the administration of additional fluid when treated with concentrated albumin. The colloid osmotic effects of 25% albumin is approximately 5 times that of a blood plasma. Monitor patients carefully to guard against circulatory overload and hyperhydration. Contraindicated to pregnancy. It is not known whether albumin products can cause fetal harm or affect reproductive capacity when administered to a pregnant woman. No human or animal data are available to indicate the presence or absence of drug-associated risk with albumin use during pregnancy. Another contraindication is for breastfeeding. It is not known whether albumin is excreted in human milk. No human or animal data are available to indicate the presence of or absence of drug-associated risk with albumin while breastfeeding. Side effects and adverse effects. For central nervous system, it causes headache, fever. For cardiovascular system, it causes hypotension, tachycardia, vascular overload after rapid infusion, and for GI, it increases salivation, nausea, vomiting. For musculoskeletal, it causes back pain. Respiratory is altered respiration, dyspnea, pulmonary edema. For skin, it causes urticaria, rash, and other side effects is chills. Nursing responsibility. Before administering, be certain patient is properly hydrated before starting infusion. Product may be administered without regard to blood typing and cross-matching. Explain and use administration of albumin to patient and family. Tell patient to report adverse effects promptly during administration. Solution should be clear, amber color, and don't use if cloudy or contains sediment. Store at room temperature. Freezing may break the bottle. Use open solution promptly, discarding unused portion after 4 hours. Solution contains no preservatives and becomes unstable. 1 volume of 25 albumin produces the same hemodilation and relative anemia as 5 volumes of albumin. Reference to 1 unit, albumin usually indicates 50 ml of the 25% Concentration containing 12.5 grams of albumin. Dilute if necessary with normal saline solution or D5W. Use 5 micron or larger filter. Don't give through 0.22 micron IV filter. Avoid rapid infusion. Rate is individualized based on patient's age, condition, and diagnosis. In patients with hypovolemic shock, infuse 5% solution no more than 2 to 4 ml per minute and 25 solution diluted or undiluted at no more than 1 ml per minute. In patients with normal blood volume, infuse 5% solution at no more than 5 to 10 ml per minute and 25 solution, diluted or not diluted, at no more than 2 to 3 ml per minute. Don't give more than 250 gram in 48 hours. Each liter contains 130 to 160 milliliter equivalent of sodium before dilution with any additional IV fluids. A 50 ml bottle of solution contains 7 to 8 milliequivalent sodium. This preparation was known as salt-poor albumin. Premature infants with low serum protein levels may receive 1.4 to 1.8 milliliter per kilogram of a 25% albumin solution per kilogram by IV infusion, 350 to 450 milligrams of albumin. Monitor coagulation and hematology parameters when large volumes are replaced. Ensure inadequate substitution of other blood constituents. Example, coagulation factors, platelets, erythrocytes. Monitor electrolyte status and take the appropriate step to address electrolyte imbalance. Discontinue albumin administration at the first sign of cardiovascular overload. For example, headache, dyspnea, jugular venous distension, Raynaud's hypertension. Balance. Monitor blood pressure in trauma and post-operative surgery patients in order to detect rebleeding secondary to clot disruption. Closely monitor hemodynamic parameters for evidence of increased intracranial pressure and cardiac, respiratory, or renal failure in all patients. After administering, monitor vital signs carefully and observe patients for adverse reaction. Monitor intake and output, hematocrit and hemoglobin, serum protein, and electrolyte levels to help determine continuing dosage. The goal is to maintain plasma albumin levels at 2 to 3 grams per deciliter or to an oncotic pressure of 20, the total serum protein level of 5.2 gram DL.
So that's my autobiography of a human albumin. I hope you never have to use me in hypovolemic shock or any extreme cases, and if so, use wisely with the knowledge and everything. That's it. Bye and thank you.